Over the past 2 months, a novel coronavirus, which causes a disease officially known as COVID-19, has turned life upside down all over the world. People are self-isolating, businesses are closing, the global market is falling, and many people are dying. One of the biggest challenges of this pandemic is the lack of information about the virus. Very few things are known for sure, and what is known is already very scary. Experts around the world have been regularly meeting to discuss and plan for scenarios based on previous outbreaks. As reported by the New York Times, a phone conference among epidemic experts has shed some light on what we may be able to expect in a truly worst-case scenario. On the call, Matthew Biggerstaff, an epidemiologist at the CDC, laid out multiple scenarios for the future of the virus. First is the question of the number of infections. Experts believe that communities have been late to take preventative measures. The virus can spread through direct contact with an open carrier, but also, and less commonly, through asymptomatic shedding, as well as casual contact and even contact with a surface that someone with the virus has already infected. Because of the asymptomatic nature of the virus in younger, healthier people, by the time there has been a death from the virus, many people will have already contracted it and passed it on. The CDC estimates that each infected person could infect between 2 and 3 more people. At this rate, and without further restrictions, there is a projection that the number of infections in the United States could range as high as 214 million, or 2/3 of the nation. However, the number of infections does not necessarily determine the severity of symptoms. As has been demonstrated so far in China, Italy, and other countries hit hardest by the virus, many carriers who show symptoms will have mild cases. While these are still very serious and debilitating, mild has been used to mean not requiring hospitalization. This is why current guidelines suggest that those who feel ill but do not require immediate hospitalization should stay home and self-isolate to help prevent hospital overrun and further spread of the virus. The CDC model's worst-case scenario is a hospitalization rate of 12% of infected people. By comparison, the hospitalization rate for the flu is approximately 52 out of 100,000 infections, or half of 1%. For the US healthcare system, this would be a massive problem. Hospitals around the country are absolutely not prepared to treat, at worst, 25 million patients within a short time period. Although exact figures on COVID-19's mortality rate are difficult to calculate due to the lack of mass testing, early studies have shown that the virus is deadlier for people with high-risk factors, like respiratory problems or diabetes, as well as those over the age of 65, and especially those over the age of 80. According to the CDC's estimates, in a worst-case scenario, up to 1.7 million people could potentially die from COVID-19 in the United States. These numbers are truly terrifying. However, it's important to note that they're based on a world where nobody is taking precautions and governments are inactive. This is not the case. Around the world, and in many parts of the United States, people are actively self-quarantining. Businesses are making huge efforts to encourage social distancing. Scientists are working around the clock on vaccines and treatments, and manufacturers are producing massive amounts of sanitizer and medical ventilators. It has taken some time for the seriousness of the situation to penetrate the social consciousness, but as people act more appropriately, the rates of infection, hospitalization, and death should hopefully fall well below these worst-case projections.